Hello and welcome. When we think about pain, we usually think of a simple ouch. But today, we're going to go way beyond that. We're diving into the hidden world of chronic pain, which is so much more complex than just an injury. Understanding how it really works is the first step to getting a handle on it. So let's jump right in.
I want to start with just one number, 24.3%. Now, according to the latest data from the CDC, this number represents a huge slice of the American population. But what does it actually stand for?
Well, let me put it another way. What's something that nearly 1 out of every 4 adults you might meet today has in common? It's not what they do for a living. It's not where they're from. It's something they're living with every single day.
That's right. Almost a quarter of all adults in the United States are living with chronic pain. I mean, it's one of the biggest reasons people go to the doctor, and yet it's so deeply misunderstood.
So, to really get a grip on this, we first have to understand the sheer scale of the problem. Let's break down the numbers a bit, see who's affected, and get clear on what we even mean by chronic pain. All right, first, a quick definition. The official word from the International Association for the Study of Pain is that chronic pain is any pain that's persistent or keeps coming back for more than 3 months. So, we're not talking about the acute pain from stubbing your toe. This is the kind of pain that just sticks around long after any original injury should have healed. And what's really interesting is who this affects. If you look at this chart from the CDC, you can see a bit of a demographic breakdown. It turns out women are slightly more likely to experience chronic pain, about 25.4%, compared to 23.2% for men. Age also plays a really big role here. As you can see, the chances of having chronic pain just climb and climb as we get older. It goes from just over 12% in younger adults all the way up to a staggering 36% for folks 65 and over. It tells you this becomes a much bigger piece of our collective health story over time. But the numbers only tell part of the story. For decades, our whole understanding of pain was, well, let's just say it was pretty basic. But science has come a long way, and it's given us a much more powerful way of thinking about why some pain just persists. The old idea was called the biomedical model. It was super simple. Pain equals tissue damage. If something hurts, it's because something is physically broken. You fix the tissue, the pain goes away. But that couldn't explain why some people have terrible pain with no visible injury at all. The new, and much better, understanding is the biopsychosocial model. This sees pain as this complex experience that's influenced by our biology, sure, but also by our psychology, our thoughts and feelings, and even our social world. So here's the crucial takeaway from that. Pain isn't just a one-way street, a signal from your body up to your brain. Our brain is actively interpreting and shaping that signal based on our beliefs, our fears, our past experiences. And this insight right here, it's the absolute key to understanding how chronic pain can get so dug in. And that brings us to the core idea we're talking about today, this hidden psychological loop that can literally trap people. It's called the fear avoidance cycle, and it perfectly shows how our mind can sometimes turn that initial acute pain into a long-term chronic problem. Okay, let's walk through how this cycle actually works. It all starts with a pain experience, an injury, a flare-up. Then, step 2, these negative thoughts, what researchers call catastrophizing, they just take over. You think, this is awful, this is never going to get better. That leads directly to a fear of movement, a belief that any activity will just make it worse. So what do? You start avoiding things, right? You stop doing stuff you enjoy, and you become hyper-focused on every little twinge of pain. Over time, that leads to disuse. Your muscles get weaker, your body gets deconditioned, which ironically leads to more pain. And that just confirms your original fear, sending you right back to the beginning of this vicious downward spiral. This quote from a landmark study really just drives the point home. Pain-related fear is more disabling than pain itself. Think about that. It's often not the actual physical sensation that's limiting people the most. It's the fear of the pain. That fear becomes the real engine of disability. Now, I know this might sound a little bleak, but here is the really hopeful part. Because we understand this cycle, we have developed some incredibly effective ways to break it. If the cycle is driven by our thoughts and beliefs, well then changing those thoughts and beliefs can be the way out. And that brings us to something called cognitive behavioral therapy, or CBT for short. As this quote from a major trial in the Journal of the American Medical Association says, it's recommended as a first-line treatment. And why? Because CBT directly targets those catastrophizing and fear steps in the cycle we just looked at. The problem, of course, has always been access to therapy. So a huge recent clinical trial decided to test some modern ways to deliver CBT. They took over 2,300 patients and split them into 3 groups. One got the usual medical care, another used a self-guided online CBT program, and the third group worked with a health coach completely over telehealth.
And the results? They were pretty remarkable. Just look at this chart. About 21% of people in the usual care group saw a real reduction in their pain, but that number jumped to almost 27% for the online group and all the way up to 32% for the group that worked with a health coach. Both of these remote, accessible forms of CBT were significantly better than the standard approach.
So the bottom line here is just so powerful. By addressing the psychological stuff, the fear, the avoidance, with accessible treatments like an online program or a telehealth coach, we can create real, measurable improvements in physical pain and how well people can function. It's just an amazing demonstration of that mind-body connection.
And this leaves us with a final, really provocative thought. That vicious cycle shows us how our brains can literally learn to be in a state of chronic pain. But the success of therapies like CBT suggests something pretty profound, that what has been learned can also be unlearned. And that, right there, offers a world of hope.